Hypochondria from the ancient Greek, abnormal anxiety over one's health, often with imaginary illnesses. Imaginary or not, the anguish hypochondriacs suffer is very real, as our Russ Mitchell has discovered.
I probably had the illness of the week syndrome.
What could the illness of the week be?
Could be anything from multiple sclerosis to lupus or a brain tumor. I mean, big things, nothing.
For years, Ava Kelberman was sick with worry.
Fear, anxiety, self-absorption. It just was ruminating to the nth degree.
But she came to realize, with help from her doctors, her problem was not medical.
She was really a hypochondriac.
Dr. Tom Delbanco, professor of primary care at Beth Israel Deaconess Medical Center in Boston, has been her doctor since she was a teenager.
Let me put it this way, she was in the office an awful lot with complaints that I couldn't make head or tail of.
And he never really minimized it. He did some tests and he suggested certain things.
Specifically, what did he do to help you get through this?
At one point, I remember he said something that I think about now. He says, Ava, don't look for zebras in the plains of Nebraska. And that kept me in good stead because it really puts things in perspective.
Dr. Delbanco has no qualms about directly confronting patients with the H word.
The reactions range widely. Some patients leave me and they get another doctor, and I know that the price of leveling with patients and being upfront with them is that I will lose some. Some of them say, boy, am I glad that you used that word and talked about it with me. I feel much better. Others will say, you've got to be crazy to call me that. You just haven't figured out what's wrong with me, work it out.
Hypochondriacs are often the subject of jokes, with none more classic than Woody Allen in Hannah and Her Sisters.
This time I really think I have something. I mean, I'm absolutely convinced of it, you know what I mean? It's not like that adenoidal thing, you know, where I didn't realize I had them out, so.
Should people take hypochondriacs seriously?
Yeah, I think that's a really important point.
Dr. Arthur Barsky is director of psychiatric research at Brigham and Women's Hospital in Boston. He's been studying hypochondria for 30 years.
It is not a joke. I mean, from their point of view, they really do have a brain tumor or lupus or multiple sclerosis. It's a belief system. And so they really are dying 1,000 deaths.
Hypochondriacs do have pain, but there is no clear medical diagnosis for that pain. Studies show that 1 in 20 people in a primary care doctor's office are hypochondriacs. It affects men and women equally.
In most cases, what does the hypochondriac want the doctor to do?
Pay attention to them. Physical exams, time, explanations, attention.
Dr. Barsky's latest book has a recipe for change. Think positively. Find a distraction. Try medication if you're depressed. And stop checking the internet.
A headache that you think is due to a brain tumor is a lot worse than a headache that you think is due to eye strain. Your idea about what's going on really affects how it feels. And people can really make, if they begin to change the way they think about the symptom, they can actually change the symptom itself.
The advice that I would probably give to people is that it can change. So am I cured? Probably not, but it's improved.
But you get a headache now, and that's
it's
all
a
it is,
headache.
a headache.
Right, it's a headache.
Emergency referrals, 2 of them, stat.
Still to come.